Welcome back to Medicare Mondays. Today's session is being pre-recorded. Today, we will be reviewing Common Open Enrollment Notices you may get in the mail as open enrollment is fast approaching. What is Medicare Open Enrollment? Medicare Open Enrollment occurs each year from October 15th to December 7th. During open enrollment, you can make changes on your Medicare coverage in most cases. This period is the only time you can pick a Medicare Advantage or Part D plan. Even if you're satisfied with your current health and drug plan, open enrollment is the time to review what you have and compare it with other options in your area to make sure that your current coverage is still best for you in the coming year. In September, you will start to receive notices with information about any changes to your current plan in the coming year. Please read all your mail that you get from your current plan. One notice of change is a brand new Medicare and You book. This September, you will be mailed a 2025 Medicare and You book. The handbook includes information on Medicare benefits, frequently asked Medicare questions, and any changes to Medicare coverage. It also includes a list of Medicare Advantage plans and standalone Part D prescription plans available in your area. The plan must cover the same benefits that original Medicare covers, but their costs and coverage rules will vary. Annual Notice of Change and Evidence of Coverage. Annual Notice of Change is the notice you receive from your Medicare Advantage or Part D plan in late September. This notice gives a summary of any changes in the plan's costs, coverage that will take effect January 1st of the next year. The Annual Notice of Change is typically mailed with the plan's Evidence of Coverage, which is a booklet that details the plan's costs and benefits for the upcoming year. If you have a Medicare Advantage or Part D plan and do not receive these notices, you should contact your current plan. Review these notices to see if your plan will continue to meet your health care needs for the following year. Keep in mind there could be significant changes or minor changes. That is why it is very important to read these notices. Annual plan changes to review on the Annual Notice of Change and Evidence of Coverage. Some of the changes you should look for are your plan's deductible or copays, which can change each year. For example, your plan may not have a deductible in 2024, but it could have a deductible in 2025. Look for changes in the plan's network. Plan networks can change each year, which means your doctor or your pharmacy may not be in your plan's network for 2025. If you see an out-of-network provider, your plan may not cover any of the costs of your care. Look for changes in the plan's formulary, which is the list of drugs that the plan covers. Formulary changes can happen from year to year, meaning your drug may not be covered in 2025, even if it was covered in 2024. If it is still on the plan's formulary, the cost of the drug may have changed. After reading about the changes of your coverage for 2025, decide whether your plan will still be able to meet your needs in the upcoming year. An extra help notice that you may receive is a federal government program that helps pay for your prescription drug costs if you have limited income and assets. There are many notices people with extra help may receive starting in September, depending on the situation. For example, in September, you may receive a gray loss of deem status notice, meaning you will no longer have extra help as of January 1st, 2025. If you think this is a mistake, call or you can reapply for extra help through Social Security. Call Social Security at 1-800-772-1213 or go online to www.ssa.gov. Apply for Medicare Part D extra help. Here is a link of other notices that are sent out about extra help. There are many of them, and you can read them at your leisure. Your state health insurance program can also help you understand extra help and how to reapply. Contact information for your SHIP is on the last page of this document. However, you can reach them at 1-888-884-8721. Notice of credible coverage. If you are enrolled into a prescription drug plan through your or your spouse's current or former employer, you should receive a notice from your employer or plan around September of each year informing you if your drug coverage is credible. Credible means that the coverage is as good as or better than the standard Medicare Part D prescription drug benefit. This notice is important because maintaining enrollment into a credible drug coverage means you will not incur any late enrollment penalty for delaying into Part D enrollment. Additionally, having credible coverage means that if you learn that you will lose such coverage and you want Part D coverage, you will have 2 months for a special enrollment period to enroll into Part D. Keep these notices of credible coverage each year. If you decide to enroll into Part D later in the future, you may need these notices as proof that you had credible coverage and should not have a late enrollment penalty. Other notices that you may receive: plan non-renewal notices. This means you receive a notice in October that you are enrolled into a plan that is leaving the Medicare program in the coming year, or that you should enroll into a new plan during open enrollment. If you do not enroll into a new plan at this time, you will also have until the last day of February 2025 to enroll into a new plan. Another notice is consistent poor performance notice. You receive this notice in late October if you are enrolled into a plan that has received a low rating for 3 or more years in a row. A low rating is 3 stars or fewer out of 5. Plans are rated on their quality of performance, such as how well they handle appeals. This notice encourages you to look at other plan options in your area. Read your Medicare statements. It is important to read your Medicare statements, especially during open enrollment as you may be switching plans. You should receive these Medicare summary notices, otherwise known as MSNs, if you have original Medicare. You can also receive your MSNs on your online Medicare.gov account. You should receive explanation of benefits. If you have Medicare Advantage plan or Part D plan, MSN and EOBs provide a summary of services and items you have received and how much you may be billed for them. Remember that MSNs and EOBs are not bills. If you need help reviewing your Medicare statements, you can contact your local SHIP or SMP at 1-888-884-8721. Medicare marketing violations. Beginning in October, you will likely start receiving mail from different insurance companies about the plans they offer. You can use these marketing informations to compare your options. Although companies can send you mailings, you should know that they must follow certain rules when marketing their plans. Some examples of marketing violations include: a plan cannot use language that suggests their plan is preferred by Medicare. A plan cannot call or email you if you did not ask them to do so. A plan cannot leave information like flyers or door hangers on your car or at your home if they come from a company that did not have an appointment with you. If you think you have experienced marketing violations, you should report it. Keep any documented proof, such as an agent's business card, marketing material, emails, or phone call recordings. You can report marketing violations to 1-800-MEDICARE or your local SHIP or SMP. You can call them at 1-888-884-8721. If you need more assistance with your Medicare, you can contact any one of our community partners listed here. We have Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, Leon Matthews Senior Center, Progresso Latino, Child and Family of Newport County, the Edward King House, and we have a 800 toll-free number for the state of Rhode Island. Thank you for watching. My name is Kim Timpson. I am the Health Insurance Coordinator. You can reach me at kim.timpson@oha.ri.gov or my colleague Jennifer Riaz at jennifer.riaz@oha.ri.gov. If you want to become part of our team, please feel free to reach out to us. We are always looking for volunteers.